If you need to administer a stat dose of medication yourself, firstly you need to prescribe that stat dose. Then go to the Administer function to record the administration of the dose. In this example, we will prescribe a stat dose of intravenous furosemide 40 mg. We start on the Prescribe Medication Chart screen. Click to select Prescribe. Click in the search field to search for furosemide. We will quickly enter the search text. Then click on Search and select the single ingredient item. Select the 40 mg intravenous stat dose form from the quick list orders displayed. Check the date and time for administration to commence and edit as required. In this example, we are happy with the defaults, so we will click on Continue. You are taken to the Medications to be added screen for you to check the prescribing before you update the chart. We are happy, so we will click on Update. You are presented with any warning relating to the prescription. To acknowledge them, click on Continue. With the medication prescribed, we now need to administer it, so click to select the Stat tab. To view the prescription. Here you will see the furosemide you have just prescribed. You can also see the green dot indicating that the dose is due to be administered. To get to the administration screen, you need to switch the view, so click the View button and select Administration. You are taken to the Administration Medication Chart. Here you will see all of the doses that are due for administration. Green dots indicating a dose is available, and alarm clocks indicating that the dose is overdue. You can still administer a dose if it is overdue. Sometimes this screen can look busy when patients have multiple prescriptions. Always take care to select the correct dose from the list. You can view the other tabs from this screen if you wanted to review the full prescription chart. Select the tick box next to the stat dose of furosemide you prescribed. Next, select Administer. You are now shown the administration screen for this dose. If administering a regular dose, you will usually be provided with information relating to the last dose recorded, including time of administration. Since this is a single stat dose, we don't have previous doses, but the summary chart in the top corner can always be referred to if you want to see the full prescription chart. Notice for this item there is a pharmacist's instruction about using a saline flush with IV medication. We need to confirm that the instruction has been completed by clicking in the tick box. The dose, as in this case, may have a volume. You will see the form and route. The time defaults to @confirm. Administration records should always be made in real time, but if you are retrospectively recording this dose, you could edit the field on this date and on this time. The reason and comment fields are not mandatory, unless you choose to retrospectively record a dose administration, but you can always add a free text comment if appropriate. Below this is the co-signature field. As per trust policy, because this is an intravenous medication, a co-signature is mandated. We will quickly complete these fields for you. At this point, we have prepared the medication. In this case, we have drawn up the injection. It is important to note that warnings relating to the medication may not appear until you click to continue past this screen. We can click on Confirm to indicate the medication is ready for administration. You are now taken to the Confirm Administration screen. At this point, you check the demographics on screen against the patient's wristband, and, where possible, ask the patient to confirm their name and date of birth as per Trust Administration procedure. Select the Confirm Patient checkbox. Now you have confirmed the patient, you are now able to administer the medication. Click on Confirm after the dose has been administered and the chart will be updated. Once the administration has been saved, you will be returned to the Administration Medication Chart Screen. And we can see that the dose is no longer present on the list to be administered. If you wanted to check the information recorded, you can simply click onto the appropriate tab and view information there.